is because the same part of the brain that controls sleep also controls the bladder. So if you're having a sleep issue, then that takes precedence and priority. And so it's going to focus all of its attention on that.
So I am here with John Peterson, and I was on Facebook this week, and I read a post of his, and it was fascinating, and I wanted to learn more about it, and I thought it would be super helpful for you guys who are listening, specifically with ADHD issues, but also just with a range of different issues. Now, John's a doctor. I'm going to have him introduce himself. He's a dentist. He does a lot of work with kids and families, so he knows a lot. So why don't you introduce yourself, John? Tell us a little bit about yourself.
Well, yeah. So my name is John Peterson. I'm originally from St. Louis, Missouri, and I went to dental school in Marquette. And I have been a general dentist for the past 10 years. And I started getting into just regular sleep dentistry about 3 years ago. And then about 2 years ago, I had a buddy that introduced me to the Healthy Start system, what you were reading about on that post.
Yeah.
And that has changed my career.
That's fascinating. I just want to bring people up to speed on what I did read on the post because I thought it was really interesting. Yeah. So this is what the post says. It says, as parents, we want our children to have every opportunity to be successful. 9 out of 10 children suffer from one or more symptoms of sleep-related breathing disorders. These symptoms can take on the appearance of ADD and ADHD, poor performance in school, lack of focus, anxiety, headaches, chronic allergies, and more. A simple Healthy Start dental screening could change your child's health for life with a treatment that is non-invasive, non-pharmaceutical, and pain-free. That actually, I was like, hey, wait a minute. There's just so much truth to that because sleep really does affect everything else that we do. But can you tell me more about the post? Why did you post it? And what were you trying to convey? What were you trying to tell people?
Well, this Healthy Start system, and let me just back it up a little bit, and let me tell you kind of what Healthy Start is. It's an alternative to braces.
Oh, okay.
That's kind of the main thing is it actually an alternative to braces, and it's a little different than braces in that you start it earlier. The perfect time to start Healthy Start is at 6, when the first permanent teeth are coming in, and you guide the teeth into place as they're coming in.
Wow.
There are a lot of other benefits, and helping with sleep problems is one of them. One thing that the Healthy Start system says that it does is it uncovers health problems while straightening teeth.
Wow.
So one of those things is sleep disorders. And so this has been around. It sounds new, but it's been around for 50 years.
Really?
And I'm just trying to introduce it into the Utah market. I've got a practice in Riverton. And here in Utah, it's just we've got 5 practicing dentists that are utilizing the Healthy Start system. A lot of people in Utah haven't heard about it. And so we're just trying to get the word out.
I have never even heard about it. So, I mean, this is fascinating. Is there a reason why we haven't heard about it? I mean, is there a reason it's not really well known in this area?
I don't know. I don't know if it's just because someone hasn't taken the lead and the charge in order to do that. I'm happy to do that. Just because I love the system so much. But I mean, and I had a dental school buddy in Colorado. He was the one that introduced it to me. And so it's bigger in Colorado, in places like Washington and Oregon, California. And it's just trying to get the word out. Now, I'm not a conspiracy theorist, but I do think that there may be some type of suppressiveness going on with the orthodontic community. And I think the reason behind that is that a general dentist like me, I can treat someone with a Healthy Start system just like an orthodontist can. And so it may negate their continuing education a little bit. Yeah. Now, I don't have any direct evidence of that, but it does seem interesting that it's not talked about more and more people don't know about it. Because more people should know about this.
Yeah, I think so. I mean, when we're looking at like a holistic approach at helping children with whatever health issues, really, we should have all the information in front of us to make a good choice. You know what I mean?
Absolutely.
And when we don't have portions of something, we actually make poor choices because our choices are limited. So this is fascinating. So like in this approach, how early would you start working with a child? I mean, at what age do you start? And is there an age where they cap out and you?
Oh, yeah.
Okay.
Yeah, great question. So it depends. So as far as the straightening teeth part, usually that starts at about 6 because that's when the permanent teeth are starting to come in.
Mm-hmm.
And you need that first permanent tooth, which is usually like the lower front tooth, to
Right.
start peeking through the gums.
Uh-huh.
Once that happens, then we can make a template for the rest of the teeth, and then that guides it into place. But if a child is having sleep problems, or if they're having like behavioral issues
Mm-hmm.
earlier on, then you can start the treatment at as early as 2 or 3.
Oh, wow. Okay.
Which is
Okay.
really early, seems really early, but there's 2 or 3 year olds that can start wearing these appliances and start benefiting from them. There are young kids that have to be on CPAP machines because of their severe sleep disorders. And many of those kids, they don't know about any other alternative treatments. Some of them, I'm sure, could use the Healthy Start system instead of going full bore into a CPAP machine.
Right. It's funny because I've seen that and I've been amazed at it. Like little kids with CPAP machines, and I'm thinking that is really odd. And I'm not a medical doctor. I don't know why they would need a CPAP machine. And I'm sure there are multiple reasons why children would need one. But I mean, yeah, we're talking about sleep and well-being and their overall functioning day to day. We all know if a child doesn't get enough sleep, they're irritable and they act
Exactly.
out. And so
And
that's
to answer
fascinating.
the other part of your question, if it caps out at a certain
Yeah.
time, it
Yeah.
does.
Okay.
So there's a growth component to this treatment. So we want growth potential, and that's a part of it. And
Okay.
so it's designed to function around like children when they're in their growth potential. So that does cap out at about 12 or 13.
Okay.
After that, then traditional braces
Yeah.
are recommended in order to straighten teeth. And they miss out on some of the other benefits that Healthy Start can provide.
Now, with Healthy Start, let's say you're starting at that young age, and what is the regimen afterwards? Like the treatment is how long, and then what is the upkeep? Because my daughter, she did the braces thing, and now we're doing retainer until she's like 20 something. I don't know.
Yeah.
Anyways, know what I mean? What is the upkeep afterwards?
And I would say that's rare. Most of the time after you've had braces, retention is a lifelong thing.
Yeah.
You're either going to wear your retainer for the rest of your life, or you'll have a permanent retainer, or you'll have both.
Right.
And that's part of the problem, is because the braces idea is to start when all of the permanent teeth have come in. Well, the teeth have already had a chance to kind of establish their home position.
Yeah.
Where they want to be. And then you're trying to move them after the fact, which requires more force. And then the other problem is after you're done, those teeth are always going to want to have a tendency to move back. So retention is always going to be a push and a major concern for any time you have braces.
Okay.
And not only can the teeth shift back, but one really frustrating thing is that if you've had any bite adjustments or if you had any jaw alignment problems, those can relapse as well.
Wow.
And Healthy Start gets ahead of that problem because we're guiding things into place while they're developing. And so that means if there's a Healthy Start patient that starts at age 6 and straightening their teeth, there is an end time where they don't have to wear anything anymore. Retention's not even an issue. And so that is a major benefit, I think, of Healthy Start.
Yeah. Well, yeah. For my daughter, they told us to come back when she's like 24. And I think that's just to check and see, but she has one that's actually, it's in there. Like she doesn't take it out at night or anything like that. So anyways, I'm like, okay, gosh, we spent all this money on all this stuff. And I wish I would have known this when she was younger. It would have been.
Exactly. And me too. I have 3 of my own kids that are in it now. I have 4 kids. Mm-hmm. And I place braces in my general practice.
Yeah.
Which is really nice because then I have a background in braces and I know all the drawbacks. Yeah. And braces still has its place. Right. And there are some kids, this Healthy Start system is not for everyone. Like if you've got impacted canines, or if you have something where you got to kind of reach up and get the teeth, or if you've got a lot of teeth that are missing congenitally, like you just weren't born with them.
Right.
Well, Healthy Start might not be the treatment for you. It might be braces. But I put my daughter in braces, and now she sees the rest of her siblings that gets to do these trays, these Healthy Start trays, and not have to worry about food restrictions. She loves caramel popcorn. She couldn't have caramel popcorn while she had braces. And
Wow.
you know, when the bracket pops off, she had to go in real quick and see me, and then I had to put it back on. You know, you have 6-week appointments where with the Healthy Start system, you can kind of spread those out a little bit, just because braces require you to kind of see the patient every 6 weeks, tighten the wires, or you do whatever you need to do. You know, we don't have to see them. Initially, you see them about once a month for the first 4 months, and then you can be like, for some patients, like, I don't need to see you for another 3 months, you know,
Right.
or I don't need to see you until your next recall. So, you know, that's a benefit. But yeah, I'll tell you, it was kind of interesting because I have a general practice, but I started a sleep clinic, a dental sleep clinic about 3 years ago.
Wow.
And the day I started it, my buddy from Colorado called me up, and he was just talking to me, and, you know, we were kind of chit-chatting. We hadn't caught up since dental school. And, you know, I don't know if this was the best question as a friend, but I was just like, hey, so why are you calling me? Because I thought he was calling me because I had just posted about how I started the sleep clinic on my Facebook page for my general practice. I was like, this must be why he's calling me. He's like, no, I wasn't. I was just calling you just to say hi, you know. And then during that conversation, he told me about Healthy Start, which also includes sleep disorders, which falls right in line with what I was trying to do with my new business.
Wow.
And I was like, you know, I don't feel like that was a coincidence. And I was just like, this is why you're calling me, you know.
Right.
I'm sure you're calling me just to be a good friend, but I just thought that was an amazing coincidence there.
So tell me more about a dental sleep clinic, because that is probably really new for a lot of people too. What is that? I mean, what does that entail?
Yeah, so sleep apnea it's just like an epidemic now. It's just growing so significantly.
Yeah.
And so there's a lot of adults that have sleep apnea. And this is kind of what got me in my foot in the door for sleep dentistry in the first place, was adult sleep apnea.
Oh.
And there's ways that dentistry can treat that. You know, it doesn't have to be a CPAP machine. If you go and see a sleep doctor, you know, it's either going to be do nothing or get a CPAP. There's really no intermediate treatment.
Right.
And so what people don't know about, if they've got mild or moderate sleep apnea, they can use a sleep apnea dental device in order to help with their sleep apnea, in order for them not to have periods at night where they stop breathing. And what it does is a device that they wear, and it pushes their lower jaw forward, and it opens up the airway so that they don't have any of those blockages at night. Because the difference between snoring and sleep apnea, snoring is a partial blockage.
Yeah.
You're still getting air in and out, but then you have the tongue that's relaxing back, and it's kind of doing that partial blockage, and hence the noise. But then sleep apnea is where you have complete blockage, where there's no air getting in and out. And so that's what's going on.
I'm kind of curious, like, so going into a physician and you are diagnosed with sleep apnea, and kids are getting it all the time. They're being diagnosed with multiple things, and sleep apnea may be one of those. They don't often recommend going to the dentist to fix it. Like, it's usually, I'm wondering why that is, why that's not an option. And you're probably the wrong person to ask for that, but I don't know.
Guesses. I mean, I think they don't even know about it. To be honest with you, I don't even think they know about it.
Okay.
So we need to go in and educate them.
Yeah.
That's been a goal of mine. It's something I'm still working on, because I've got to run a practice as well. I've only got so many hours during the day, but I would love to spend more time going in and seeing sleep specialists, going and seeing ENTs, going and seeing pediatric, you know, the regular pediatric doctors, in order to tell them about this Healthy Start system, because they probably don't even know about it.
Yeah.
And that's half the battle. They have to know about it first before we can start having those lines of communication.
Right. Okay. You're just kind of blowing my mind at the moment, because, I've seen children with CPAPs and adults, and it's amazing how many people are using those devices when maybe they don't really need to. You know what I mean?
Well, and that's just the thing, is that, are they using the device? You know,
that's the other question.
Gotten the device, but after a little bit, there's a lot of people that start using the CPAP and get frustrated with it and stop using the CPAP. And I have a lot of patients that are in that category.
Yeah.
Severe sleep apnea, they should be using a CPAP machine. You know, my dental device, it's not recommended for people with severe sleep apnea. But I'll tell you this, it's better than nothing. If they're refusing, if they can't for some reason wear a CPAP machine, then it will help them. And so that's part of the problem, is that I think I've seen some studies where as low as like 30% of people are actually using their CPAP as prescribed, as they should. That's a big problem.
Yeah, it is a problem. And the complaint that I get from most people who use a CPAP machine is it's awkward. It falls off the face. Some people like to sleep on their stomach, and it's just weird. The cord is, you know what I mean?
Yeah.
So, I mean, I think that there's a lot of reasons why people don't wear it.
Exactly.
You know, but I mean, if we could find an alternative, and I think that that's where my biggest concern is that unless people are informed, they really can't make great choices, you know, and that there are other options out there, specifically for parents with young children who are on a CPAP. I mean, if this is a different option for them, that's a great thing for them to start to investigate and explore, right?
Yeah, and to bring this back to Healthy Start, a lot of these problems, so these full-blown sleep apnea problems in adults, the seeds of that are planted when they're kids from bad habits and other things that are happening during their development.
Right.
Part of that is like, so for instance, one thing that the Healthy Start system, what we're really trying to get at, they're getting them out of bad habits, like for instance, tongue thrust or mouth breathing. You know, both of those things, they have tremendous developmental effects. And I didn't even know about it. I mean, me going to dental school, not emphasized, you know, we learned a little bit. So for instance, tongue thrust. My basic knowledge was that, well, you don't want the tongue to be pushing against the tooth because it's going to start flaring out the teeth. And so that was the extent of my knowledge. Okay. Now I know that if you don't have proper tongue positioning, if you don't have a tongue that is resting on the roof of the mouth, then that actually makes it so that the upper jaw doesn't develop like it should.
Really?
So the tongue is what expands the upper jaw. So if you don't have that in the right place, then you've got a narrow jaw. And if you've got a narrow jaw, then you don't have as much room in order to work with when you're sleeping. And so you've got more of a possibility of, when you're laying on your back, of your tongue to just get in the way. Wow. The other thing is that if you don't have proper tongue positioning, then you might have a tongue that's not strong. And so it just kind of hangs down in the mouth, contributing to mouth breathing. And mouth breathing can cause a whole host of other problems. If you've got mouth breathing, then you've got that humid air going past the tonsils. It can enlarge the tonsils. Mouth breathing can stop your development of, if you see a child that is a mouth breather side by side with one that's not, they've got their development of their face and their jaw is stunted. And so that's something I did not know about.
I didn't actually. While you were talking, I'm checking my own tongue and where it is in my mouth. It's kind of really bizarre. I'm like, am I pushing up? Is it wide? Do I have a narrow? No, but these things we definitely want to be aware of, and especially during the developmental age of children, right?
Oh yeah.
What questions should people be asking their dentists? Like, what questions should parents be asking their dentist, or even having a discussion about? Because usually it's just go in and come out. I mean, should there be a discussion going on?
Absolutely. So I actually recommend, if a patient has a child between the ages of 6 and 12, I automatically recommend Healthy Start and not braces. If they're a candidate for Healthy Start, they should do Healthy Start, because they have all the, so braces is just aesthetics. It's kind of like the guy that is always looking in the mirror. Yeah. You know, and always checking themselves out. That's kind of what I feel about braces now.
Okay.
It's just concerned with aesthetics. It is concerned with jaw alignment, but mainly it's just aesthetics.
Yeah.
Whereas there's so much more depth to the Healthy Start system. Braces doesn't care about these bad habits. It doesn't care about tongue thrust. It doesn't care about mouth breathing. It doesn't care about as much as these developmental problems, because they're not starting it early enough.
Right.
And so there's so much more depth to Healthy Start that I just recommend it between the ages of 6 and 12. Now, if there's a child that has some of the health issues that we're talking about, and so these are things like grinding their teeth, behavioral problems, chronic allergies, ADHD, which I'm sure we'll get into more.
Yeah.
You know, some other things. If they have these things, then definitely a conversation should, you know, snoring. I have a daughter that snores, or she did until she got the Healthy Start appliances, and now she doesn't snore anymore.
Oh, wow.
Wetting the bed. That is another thing. And that one didn't quite make sense to me. And so I had to look into it.
Yeah.
You know, because I always thought that wetting the bed happened because you're in too deep a sleep. But I had to be educated on that. And the reason why the Healthy Start system helps with wetting the bed, and it does, and I can tell you that it does because I've had patients tell me that their kid doesn't wet the bed anymore after starting the treatment.
Right.
Is because the same part of the brain that controls sleep also controls the bladder. So if you're having a sleep issue, then that takes precedence and priority. And so it's going to focus all of its attention on that. And then then let go of the bladder.
Wow.
And so then at that point, then you can wet the bed.
Yeah.
Well, I didn't know that. That was something that I had to be educated on.
Wow. I am like, now just thinking about if I'm ever wet the bed. Is that
right now or earlier?
Yeah, I know. It's like, what is going on? Yeah, my ADHD is kicking in. Hyperactive, inattentiveness sometimes is a little. Anyways, so I'm curious though. For behavioral issues, then I guess a dentist doesn't really hear a lot of the behavioral issues that are involved, and they probably shouldn't actually hear a lot about that, right? Or should they? I don't know.
Well, the conversation usually comes up for a different reason. I'm usually not just all of a sudden asking parents about behavioral issues.
Right.
But when a child is like 6 and they come in and I see that first permanent tooth is coming in, then I start talking about it. Then I start talking about this alternative to braces.
Yeah.
And then we start talking about all these other things that it can help.
Yeah.
And we start talking about behavioral issues. And they see the list of all of these symptoms that are related to sleep disorders. And they're like, you know what? My son has aggressive behavior. My son grinds his teeth. My son wets the bed. And then they start linking some things up. And then, you know, we can talk about behavioral issues. Once we start the Healthy Start program, we start with a records appointment. And so we get x-rays, we get scans of their teeth, and then there's a questionnaire that we ask parents.
Okay.
Sleep is involved with that. Behavioral issues are involved with that. One interesting thing is that Healthy Start has had a chance now to treat over like 3.5 million children around the world.
That's fantastic.
And they have all this data because they have the data of all of the questions that we ask the parents about these behavioral issues.
Yeah. And
they always follow up after the fact. So during treatment, they want to know if the Healthy Start system is improving things.
Yeah.
And it does. And ADHD is an interesting one. When you're doing clinical studies, you know, people that have done the studies, you can't really tell a difference between a child with ADHD symptoms and a child that's sleep deprived.
Yep.
They look the same.
They look exactly the same. Yeah.
And so one thing that they know now is that by using the Healthy Start system, it helps with the symptoms of ADHD.
Oh, wow.
So
yeah,
it's very interesting. I was looking at a study and it was interesting. So it's complicated, you know, because it's hard to tell. They said that the relationship between sleep and ADHD is bidirectional. So it means that the sleep cause, like a lack of sleep or poor sleep, cause ADHD, or does ADHD cause sleep problems? Or sometimes it's cyclical, like they're both negatively influencing each other.
Right.
What the study concluded was that it's saying at least 25% of the time they feel like a sleep problem is causing the ADHD. And 60% of the time, sleep is involved. So whether it's causing it, or whether the sleep is causing ADHD or ADHD is causing the sleep problems, sleep is involved.
Yeah.
And I guess for me, the 25% of the time where sleep is causing it, that's a no-brainer. Do some, you need to do the Healthy Start system.
Right.
That could help the symptoms of like alleviate the symptoms altogether and treating the underlying cause of ADHD. It's not medication, where that medication I feel like is a Band-Aid. Fix ADHD is not addressing the underlying cause. And so we're getting to the underlying cause by treating the sleep symptoms. But let's say it's the other way around. Let's say that ADHD is causing sleep symptoms. Well, you also want to have then at that point, you want to have the most optimal sleep that you can.
Exactly.
I still feel like this treatment could help either way.
Right. No, I completely agree. There's a component of rest and the ability of the mind to take a break that is necessary for kids to actually learn new things and learn skills. I mean, the inability of a child to really focus. I mean, I can't focus, but the inability of people to like not be able to focus has a lot to do with their ability to just be calm and have the resources, the battery power to kind of move forward. You know what I mean?
Oh yeah. Well,
So,
and if you think about sleep, I mean, us as adults are supposed to be getting like 8 hours a day. Kids,
right.
Like 10.
Yeah.
That's a big part of your day. And then sometimes it's sleep deprived because they're not getting the quantity.
Yeah.
But a lot of times it's the quality. It's a quality sleep problem. And so that's harder to recognize for parents, because they're like, well, they go to bed at 8 o'clock, and they get up at this certain time, but they're getting enough sleep. Well, sometimes that's not the problem. Sometimes they're not getting the quality sleep that they need. They're having apnea type episodes. They're having situations where they're restless during the night, and so their brain isn't getting the rejuvenation and the rest that it needs.
Okay. I love this. Actually, this is so fascinating. But I'm thinking of a parent who actually goes into the physician's office, and a lot of times they're the first reporters and they are the first people to actually say what is happening. They show up and they say, my kid has ADHD, and the doctor sometimes like, yeah, whatever, yeah, everybody, and may dismiss it. And if they recommend doing a sleep study on their child who's maybe 4 or 5, is that a weird request? Does that seem normal, or you know what I mean?
Not anymore, because before, you hear of sleep studies and you hear, like, you imagine, and I don't know, you see pictures of all these electrodes attached and all these wires
stuck all over you,
straps and all of this stuff attached, and you're going to a hospital setting or you're going into a controlled environment. And we're just starting to get away from that, because I don't think that's effectively testing your sleep, getting put into that type of environment. So we've got these home tests now. Are much less invasive, a lot easier on the kids. And so, no, I think it's much more appropriate to have them have a sleep test now, and to figure out what's happening, and it's usually only one night where it's required, and you need to get about 5 or 6 hours of data, and that's all we need in order to figure out if sleep is an issue.
Okay. So for a young child, what is it? Are they just have some wires hooked up to them, or? Sorry, I don't know. I don't know how that works, but.
So usually it's just like it's like a chest strap, and then a strap kind of around their waist.
Yeah.
And then they have a little watch on and something on their finger.
Okay.
And then we test actually for grinding as well.
Oh,
which
wow.
is important to know, and we can get into that in a second. But we have something on their jaw right here in order to test that, and then a very small cannula that kind of goes up into the nose just a little bit. And I've done this myself, and it's not a big deal.
Okay.
And those are kind of the main things that those are the main things that we're looking at. And it's a little uncomfortable, but comparing that with what it used to be,
right,
I don't think it's that big a deal.
Okay, that's good. I'm glad because I mean, I'm thinking of, yeah, how uncomfortable it would be. I'm just familiar with the old style where you went to the hospital and, somebody was actually watching you through the night. And it was
Right.
kind of like, I'm supposed to sleep here? This is
Right.
weird,
Exactly.
And they told you to bring a pillow, they're like, bring your own pillow and anything to be cut. It's like, I'm not even in my house. This is weird.
Yeah,
Anyways,
it's gotten much better, much better.
yeah, I've done a sleep study, ladies and gentlemen. So that's the way I did it. And it was weird. So it was really bizarre. Anyway, that's great. So for kids, it's super easy. I mean, it's something that parents can do. And now that I'm thinking about it, wow, what a simple thing to do rather than let's try some medication for a couple of
Oh
weeks
yeah.
and then see what side effects there are and then, and then adjust from there. So
Yeah, and it's important because some of these kids are getting misdiagnosed, and I
yeah.
don't think there's any other word for it.
Mhm.
ADHD, getting misdiagnosed and saying that they have that, and then getting on medication,
Yeah.
and where it is actually a sleep problem.
Right.
Well, that's kind of a big deal.
Yeah.
The nice thing about the Healthy Start system is it's just multifunctional. There's so many things going on. Okay, so it's going to be helping sleep problems regardless if your child has ADHD or not. Nine
Right.
out of 10 kids suffer from at least one symptom related to sleep disordered breathing.
Right.
They're going to be helped,
Right.
and they're going to have their teeth straightened at the same time, and they don't have to go through braces. One problem, bringing it back to braces, is that I treat about 50 kids at any one time in my practice
Uh-huh.
with traditional brackets and wires. And kids these days do not have the patience to take care of their teeth like they should. They just are not doing it.
Yeah.
It requires about 10 minutes, which normally takes about 3 minutes. It takes 10 minutes for a child that has brackets and wires on. And they're
Wow.
just not doing it. And so what's happening is that there's plaque accumulation, food's getting caught everywhere, and
Yeah.
it's having a detrimental effect on the teeth and the gums. And so they're at least getting some white spots on their teeth, and the white spots are coming because that plaque has been sitting so long that it's starting to leach out the calcium in the teeth, and
Oh,
it can go from there to cavities. It's common for kids now that I'm seeing to get cavities because they're not taking care of their teeth,
wow.
or they get puffy gums. And
Right.
some of these kids get puffy gums to the point where after the brackets come off, they've got to get laser surgery done in order to reduce the gums.
Holy cow.
And so,
Okay.
and then there is some cases, and I've had to do this a couple times, where the child's teeth are so negatively affected from braces
Yeah.
that I've got to take them off because their
Wow.
teeth are starting to get so decayed and
Yeah.
such in bad shape. And, braces are great, but there's a point in time where it's not worth it.
Yeah.
It's not worth having all of this extra metal in your mouth if that's going to be the effect once we're done. And so
Right.
it's better just take them off at that point.
Okay. I'm going to ask you a question I know parents are going to ask. What is the cost difference between the two programs? I mean, if you do braces, what's the average cost for that?
Yeah, the average cost for braces is usually about 4,500.
Okay.
That's about
Okay.
the average cost. I
Yeah.
don't know what the average cost of Healthy Start is because there's just not a lot of dentists, and I haven't
Yeah.
asked.
Yeah.
I mean, it kind of probably depends on the area,
Yeah.
but I'm charging 37.50
Yeah.
for Healthy Start. So
Okay.
there is, I mean,
There's a price
talking about
difference.
there's a savings
Right.
on it, and part of that is just because there's not as much chair time. So,
Oh,
like I said before, braces, it's every 6 weeks clockwork. When they're
yeah.
starting to get towards the end of the treatment, sometimes I shorten that to every 4 weeks.
Okay.
With the Healthy Start system, then we can start spreading that out. Now, they have it for a longer period of time
Yeah.
because like I said, they started at 6, usually, and then they have it until all of their permanent teeth are in. And so that's usually about age 12 or 13.
Right.
But to keep in mind, and some parents at this point are like, dude, 6 years of treatment? No way. But what you have to remember is that these trays, you're just primarily wearing them at night.
Yeah.
There's a daytime component to them, but that's usually about 1 to 3 hours.
Mm-hmm.
And so it's when the child's doing homework or watching TV or playing Fortnite or doing whatever they do.
Whatever they do. Yeah.
They
Right.
just do it at that time. You don't have to worry about it when they're at school. And you don't have to worry about it when they're out playing with their friends. It's kind of designed to where that daytime component they can do it during those downtimes. And that daytime component usually only lasts between like 12 and 18 months.
Yeah.
And then they're just wearing it at night. So if you started at age 6, then, you know, by age 7 or 8, all they have to do is wear the trays at night. And, you know, my kids are to the point now where it feels weird for them not to have the tray in. And it doesn't take long for you to get to that point.
Right.
It feels weird for them not to have it in. So then it's easy. It's so easy for them to just remember to put it in.
Yeah.
And then it just takes care of itself. You don't have to worry about appointments as much. You don't have to worry about brushing and flossing for 10 minutes. You don't have to worry about food restrictions. You don't have to worry about so much because it's just taking care of it at night. And as the teeth are coming in, it's requiring less force in order to guide those teeth in place. One thing that's interesting is that with braces, it does require more force. And so this varies, but 100% of the time, you're going to have something called root resorption happen. And that's where the roots of the teeth shrink a little bit. And sometimes it's just a little bit, and sometimes it's a lot. Sometimes I take an x-ray of someone after they've had braces. Yeah. And they've got these short little nubby roots now. Ooh. So that is a stability issue at that point for the teeth. Yeah. One thing that's awesome about Healthy Start, since it's less force, you just don't see root resorption. Oh, wow. So there's all these little, and I'd say big, that's a big thing. There's all these big benefits to Healthy Start that, you know, it's a no-brainer for me. Right. You know, I can happily recommend that to anyone that has a child between the ages of 6 and 12. It's a no-brainer. I'm recommending it.
No, that's fantastic. Okay. You know, it's weird because I am actually thinking of making recommendations for people to go in and talk to their dentist when they come in for therapy, you know. Yeah. Because that actually is the most reported disorder that parents come in with. And the symptomology for ADHD fits, but I didn't know that there was this whole other component that we could use as far as treatment to assess whether or not it's really ADHD or if it's sleep deprivation or just something else. You know what I mean? So
yeah, and it's like I said before, it's kind of changed. It's changed my whole outlook. It's changed the way I practice dentistry. Yeah, and it's interesting because the impact of it is so much more. Yeah, you know, I'm not going to have a parent come and give me a hug because I just filled their child's tooth. Yeah, you know, that doesn't happen. But if I'm helping solve their behavioral issues or helping them do better in school, right? Then, you know, that's just so much more impactful. Parents are so appreciative that, you know, there's, you know, it's that impact for that child is so much more that juices me. It kind of motivates me. You know, I would have probably like 5 years ago doing an interview like this. Yeah.
You're like, no way.
It's okay. You know, I'll just do my thing. I'll see my patients, but doing an interview like this would have probably been beyond my comfort zone.
You really? You're pretty passionate about this then.
Oh, yeah, definitely. But now I just, you know, I feel so passionately about getting the word out. And like we talked about before, this is a market where a lot of parents don't know about it. Right. But it pushes me over any type of reservations that I might have to come on and talk about it. We're going to talk about it.
That's great. You know, one of the things that we do with Smarter Parenting is we try and educate parents that children are a lot like investments. You have to do a lot up front, and you have to establish boundaries and rules and all of that. And the more successful you are at doing all that work up front, the less maintenance later on. And it sounds that's exactly what you're suggesting, and what the program does is you're investing this while they're young. And that's what we recommend, is doing this all when they're young, because the payoff in the long term it's a lifetime change for them. And so what you're saying totally resonates with me, because we're not doing a cosmetic fix. You know, we're not just going to fix it and slap a Band-Aid on it and call it good. We're actually looking at what's going to happen down the road when they're adults and even beyond that. So
yeah, and far-reaching implications. Yeah. On the dentistry side, you know, you could help from getting relapse for the teeth moving back or the jaw moving back. From the sleep side, I've heard studies say that a sleep problem, if you've got a sleep problem, that could shave as much as 10 years off of your life.
Exactly.
So we're talking about huge changes here. I mean, who wouldn't want to add 10 years to their lifespan? And this is what we're talking about, getting up front in front of these problems and trying to get rid of these bad habits early on. And Healthy Start is so forward thinking that I'll just bring this up really quick.
Yeah.
Actually, we ask questions about when the child is between, the ages of 0 and 2. We're asking questions about, development during that time period, because some of these things, it starts right from the beginning.
Wow.
And so that's really forward thinking. And I want to be a part of something like that.
Yeah. Yeah, absolutely. Where can people go to get more information about Healthy Start?
Yeah. So it's a little different, because healthystart.com, I think, is something different.
Okay.
It's, you have to put The Healthy Start. It's The Healthy Start.
The Healthy Start. Okay.
I'm just going to check on that real quick, because I think I just want to make sure it's not .org. So The Healthy Start. We'll just put a .com and see if. Yep, it's thehealthystart.com.
Okay, we'll go ahead and
talk all about it. The other place that I'll tell people to go.
Yeah.
It's to my sleep clinic website.
Okay.
I've actually created like 3 short videos, 2-minute long videos that kind of explains everything. And so that is at go.wasatchsleepdental.
GoWasatchSleepDental.com.
Go.wasatchsleepdental.com. So instead of www, it's the go.
Okay. You know what I'm going to do is we're going to actually include that on the websites and on the podcast. So for whoever's listening or watching, because this actually goes out both podcast and blog, we will go ahead and include the link over so parents have access to the video that you've created, and that should help guide them a little bit, and they can actually contact you through that too, right? I mean,
absolutely. Yeah.
Okay.
We'll start having a conversation at that point. They can start getting a lot more information. So
that's fantastic. I am actually going to do that and recommend that my colleagues do that when they receive a client. We always recommend that they go do a physical with a physician, but we may actually request some more information and this as an option, because again, I'm a firm believer in providing options and letting parents figure out what's best for their children, largely because they really are the experts, because they're there all the time. And so.
And the other place, because this is where you found out about it, is the Facebook group. Yeah. And Healthy Start Utah is the Facebook group.
Okay.
And they can join that. And I post about it 2 or 3 times a week. There's a lot of information. The videos that I made around there's a couple other things. I'm going to continue to post stuff about that. The ADHD specific post that you saw.
Yeah.
It was one of those. It's so multifaceted. I mean, we could probably talk for another 2 hours about this. It's so multifaceted. Cow. I'm never gonna run out of material to post.
No, that's fantastic. In fact, what I want to do is reserve maybe a future discussion about this, if we could, because I'd like to follow up a little bit. And what I want to do is reach out and get some questions, because I know this is going to bring up a ton of questions from people who follow Smarter Parenting. So,
anytime you want me on, I'll be here.
Oh, that's fantastic. So what we'll do is we'll include the links over there and include information on the Facebook group, because that's probably a good place to communicate with you, but also with other people who are thinking about this as an option or doing this or interested in what it is you guys are doing. I'm glad you're bringing this to Utah, seriously, because we have so many kids here. I mean, per capita, we kind of have overdone it here in Utah, so that's okay. But it's a resource that's definitely needed, and I think it just needs to really be out there. I think people need to know more about it. So
and I think it's awesome what you're doing with helping parents, with children with ADHD.
Yeah.
I mean, that's really cool that you have this resource for them that they can look at in order to get help. So, and, I didn't know about your podcast, and so I started checking it out myself.
Well, we just started the podcast thing.
So. Handsome mug.
Oh man, I was asking for a raise because I want plastic surgery to kind of,
No way, man.
I'd be like,
Loud and proud, Siope. You got the face of an angel.
I gotta. Oh, I'll pay you money later for that. That was so nice. That was so nice. Is there? So we're going to talk with John actually a little bit later. I want to get some comments and some questions from you about this because this is really innovative, especially for parents who are looking at alternative treatments other than hitting medication straight off. There are so many parents that are thinking, let's try something else before the medication. And this is an option that would be super helpful and actually gives you more information about your child. So we're going to talk to John a little bit later, but send in your questions and go to the podcast, to the website, and also to our Facebook page. We'll include links over to all the websites that John's mentioned in this episode. So that's it from us, and we will catch you later.